Hello everyone. So today I'm going to talk about something incredibly exciting which is transforming our healthcare field completely. I think yes, you all have guessed it right. I'm talking about the artificial intelligence or AI in short. So today morning I was just casually browsing on the internet that what is the role of artificial intelligence in the healthcare field, and there were n number of videos where doctors were saying that because of the AI, because of the advancement in the AI, because of the tool like ChatGPT 4, the work has become a lot easier. Many of those doctors, they were accepting on the internet that because of the ChatGPT 4, their clinical decision making skill has become much more efficient, and it is completely helping them in saving their time.
By using technology, we can have doctors' time be used where it's needed rather than for a lot of the automated administrative tasks or some of the tasks that can be delivered automatically to patients in between appointments to help them manage their symptoms.
And that is where I have thought of making a video on this topic. So I have been teaching Doctor of Pharmacy students over more than 7 years. And when the Chat GPT first came after the pandemic, I have to accept that I was a bit skeptical at that time. I have strictly instructed my students to do not use ChatGPT in solving the clinical cases, because at that time what I thought is that those softwares, they were not reliable. They were giving more of a generalized information, right? Or even I used to think that it is not ethical to use ChatGPT in a responsible field like healthcare, right? Or you can say maybe I was scared that my students would come up with the answer within a minute solving that clinical case, and I'll have to come up with the new complex clinical case, which can keep them engaged for remaining 2.5 hours in the practical lab. I think the latter one is right. So the thing is, has my perspective changed? And my answer is yes. See, there is this famous quote from the scientist Charles Darwin: it is not the strongest that survive, it is not the most intelligent that survive, but it is the one that most adaptable to the change that survive.
If we are blocking technology in our schools that are being used in businesses across the country and around the world, we aren't adequately preparing our students to enter the 21st century workforce.
See, we have to accept the fact that AI is completely changing the game of healthcare. The impact is really huge. Recently, I was searching on the internet and I found that there's this colorectal cancer which can be treated easily if it is detected early. But the question was how to detect it early, because in a normal colonoscopy report, if there are some small polyps or the flat polyps which can be a early sign of the cancer, they are not visible. There is this AI module called Medtronic Genius. It claims that it can detect those small polyps or the flat polyps, and now the cancer is treatable. So what am I saying is that AI is helping the doctors to see the things which are not visible with the human eye. I believe is that artificial intelligence is the key in this new era of personalized medicine. So when we talk about personalized medicines, or we can say individualized treatment, or there is this new term which is emerging now, precision medicine, the biggest challenge we face is patient load and complex medical information. See, we have to accept that after the COVID pandemic, now we are living in the era of infodemic. Every day new medical information is coming into the market, and it is hard to keep ourselves updated with the all those new information. Just imagine this: you are working in a hospital setting as a clinical pharmacist, you are attending the patient in your ward rounds, and if you try to cover all the information pertaining to the patient, like patient's disease history, drug history, patient social history, family history, drug interaction, side effects, adverse drug reactions, appropriateness of the medication, patient's medication adherence, if we try to cover all those aspects in each and individual cases, right, it takes lot and lot more time. So what am I saying is that though our human brains, they are incredible, it is next to impossible for anyone to remember each and everything about the drug. If we try to remember everything, it is like trying to catch sand with the hand, it just slips away. I believe that integrating artificial intelligence like ChatGPT in clinical field is not just about being smart, it is a necessity. With the help of ChatGPT, we can save a lot more time in solving complex clinical cases, and we can actually focus on the things that matters, like actual patient care, improving patient medication adherence, individualizing the treatment, improving the patient outcome. See, there will always be a limitations with the ChatGPT, like data privacy, ethical concern, biasness in certain answers, and we can also not rely on it completely in some crucial cases where the information is very crucial, right? But we can use it more as a assistant tool. We can use it more as a clinical decision making assistant. In conclusion, the integration of artificial intelligence in clinical practice is not a distant future, it is a present reality. With the help of tools like ChatGPT, we can enhance the skill of solving complex clinical cases, and we can focus more on a patient care. However, we should not forget the ethical and responsible use of these tools to realize the full potential of this AI technology. See, now many people will argue that we have tried using ChatGPT in solving clinical cases, but it gives more of a generalized answer, and we cannot actually apply those answers in a real practical scenario. Now, this is happening because we are not asking the right question to the ChatGPT. Asking a question to ChatGPT is like asking a question to Genie. It gives answer based on what you have asked for. So that is where the concept of prompt engineering comes in. Prompt engineering, basically it means like learning a magic word or using a magical word to get the best possible answer. So in my next upcoming video series, I'll be making a videos on topic like mastering prompt engineering in solving complex clinical cases, where I'll be using actual clinical cases and will be applying different kind of prompt to that clinical case, and we'll see how it helps in solving those cases. So stay tuned for that, and do like and subscribe to my YouTube channel.